right, so we'll get started. So this talk is professional development of an REI advanced practice provider, how to be involved within the clinic and outside the office. So we're just going to introduce ourselves first before we start. So I'm Shana Perman. I'm a physician assistant at Shady Grove Fertility. I am really short, so I feel like I'm looking at the microphone. So I work at the DC office primarily. I have been a PA for about 20 years. I did my first 7-ish years in the neonatal intensive care unit. And then I have been in fertility for the past almost 12 years, and I've been at Shady Grove the whole time. I'm going to let Nicole introduce herself.
I'm Nicole Callahan. I am a nurse practitioner at Mayo Clinic in Minnesota. I have been a nurse practitioner in REI for 6 years now, and before that, a family nurse practitioner in primary care for the past, 11 years before that. I'm excited to talk to everyone. It's important that this is going to be a conversational topic today, so we'll review quite a few slides, and then we're hoping for a robust question and answer session.
Come on in.
Come on in.
There's seats up here. Okay, so what we're going to talk about today is to explain the value of a mentor and how they can help with a new to practice APP. List examples of continuing medical education opportunities within the field of REI, and then identify areas for community involvement. So for disclosures, myself, I am a consultant and independent contractor for Faring, and Nicole has nothing to disclose. So what we're talking about today are first days in a fertility clinic, mentorship, continuing education and learning opportunities, and then just kind of moving deeper into your career. So when we talk about this, I like to start, I think when someone starts in an REI practice, you just get so overwhelmed and you're kind of drinking from a fire hydrant and you don't really know where to start. So I think the best thing that new to practice REI APPs, as well as their mentors, just reminders to start really small. So how do you navigate your practice? How is the structure of it? Obviously, it's a lot more in depth if you have a really big practice versus a small practice. Just the administration and the company structure, who kind of reports to who, how does that chain work within your practice? Little small things like how do you ask for PTO? How do you put it in the system? Just those like main things of like feeling like, okay, pass, like I know where the bathroom is now, like where, like how does this practice work? Talking about specifically holiday and weekend shifts and how to prepare for them for that once they start in the practice, and then reimbursement for CME, that is obviously a big part of our continuing education. So making sure that everyone within your practice has a touch point with the new person. There's a variety of providers in every practice. Everyone is saying the same information but using different words. And I think it's a really cool opportunity as a new to practice APP to make sure that that new practice person is, even if they're specifically designated to a certain mentor, that they are going around and talking to a bunch of your staff and providers. It's a really cool opportunity that you don't get anymore once you're practicing, to hear how people phrase things, what types of words they use, how they relay them to patients, how they explain something. So it's a really interesting opportunity when you're new to be able to hear all of that. The next thing are mentors. I think when you have new to practice APPs, I think it's helpful for the mentor to point out what your practice does really well, to make you feel valued and appreciated, and to have that good satisfaction. So sometimes those little things aren't learned until later, and I think it's nice to point them out so that they can kind of keep their eyes open and see that appreciation. The next thing I want to talk about is team building. I think it's really beneficial. I mean, it kind of sounds like dating advice a little bit, but it's really helpful to meet outside the office. It just takes a relationship to an easier conversational level if you know someone not just in the office. Everyone acts a little different when they're at work versus outside. It just helps to get to know who you're working with. I think this is really important when we have a lot of telehealth right now. So if you have a lot of teleworkers in your practice, I use the example, if someone who is not very visible at the office does something wrong, which we all do because we're human. If you know that person really well, you're like, this is no big deal. This is fine. This is how we're going to fix it. If you don't ever see that person or you just know them from email, you're like, did you see what so-and-so just did? How are we going to fix it? You don't have that ability to give grace. So especially when you have that new person in your practice, I think it's really important to really think about, do you really want tele to be part of that when you're first starting out in a practice? So I like to explain how organization is really helpful when you're getting involved within a practice. Tracking of licenses. So me personally, I have 4 licenses. They have 4 different expiration dates. They're on different cycles. Then my DEA, my NPI, all of these state licenses for controlled substances. So I do have, some people who live in that region. So I live in the DMV region. So there's all these different states with different regulations. So I have an Excel spreadsheet that has all of my expiration dates. I think it's really helpful if you're in an area that you're going to have multiple licenses to work with, just to show someone how do you follow along with that and keep track of it. And then the next thing I wish I could take credit for, but when I started at Shady Grove 12 years ago, I had a nurse in our practice who talked about her sunshine folder, and I still use this to this day. So mine is not an actual folder, it is a folder in my email. So whenever I get an email that, thank you, you did a great job fixing this, I really appreciate everything you did, or I have a patient that sends me an email, I just put it in there, and I think it's really helpful to look back on it when you have that day where you're like, this is a terrible day and I don't know what I'm doing. Which you do know what you're doing, and everyone has bad days, but it's very hard to come back from that when you're in the moment of feeling like you're just inadequate. So it's a really nice folder, just open up and be like, okay, I am good at what I do, but it's just a tool to use when you have those really hard days, which everyone has. So once you've kind of captured that practice, branching out to the REI community. Here. So becoming an APP professional group member is a huge help. So we started the professional group about a year and a half ago. We have now a little over 320 members. So we are a massively growing group that has still so more APPs that we have not captured yet. But this group is instrumental in making you feel like you are not on an island, which a lot of APPs can feel when you're in a practice that has 1, 2, 3 APPs. So this community of APPs is really helpful. When you belong to that group, there's discussion boards, we have webinars. So it's really helpful to be a part of something larger and feel really connected. So when you're talking about becoming a member of that, you also get lots of contacts within other branches of the fertility practices. So you create these phone a friends, whether they're mental health professionals, genetic counselors, supporter advocacy groups, surgeons. It just helps kind of build your network and branch out and be able to have a lot of different touch points. So where you're looking more, so when you have a new practice provider, you can only learn so much from your training and your mentor, and the rest is kind of up to them or you, what we're talking about. So where you can go to learn some more, so obviously ASRM and SART are great places to start. This next slide, I have to give credit to Dr. Jared Robbins, who did this for a presentation for us, but I loved how this works. So a lot of people don't really understand how ASRM works. So if you start at this hub with ASRM as this main spoke, and then you have the affiliate groups around it. So you have all these different organizations around it. Those, as each one of those run, makes ASRM run. And then you have the professional groups that all feed into this. And then you have the SIGs and these subcommittees. And all of this is how ASRM works. So it doesn't matter if you're affiliated with something in the middle, all the way here, all the way in the corner. Whatever you're doing and a part of helps make this organization run and is a vital part to continuing what we do on an everyday basis. I'm now going to hand it over to Nicole to continue our chat.
Just so I can get a feel for the audience, how many are APPs? Oh, wow, that's so awesome.
I love that.
And then how many are part of the professional group, the APP professional group? Good, we've got some work to do. How many work with APPs? Wonderful. And then how many have no APPs but just want to learn more? Thank you for your bravery. Okay, well, the first thing that I'm going to talk about is mentorship. Shana had touched on this, and I think the best quote that I hear from Shana is, if you don't have one, get one, and even mentors need mentorship. And so often this is a continuum across our careers that when I first started as a baby NP, I was like, where do I go? Who do I talk to? Who can help me out with these things? And so, believe it or not, other than just good advice and great quotations, there is data behind this, that we know if you can find a good mentor early in your career, mid-career, or even late career, often you'll have a higher number of promotions. We know that mentored professionals have greater compensation and report higher career satisfaction. I'm just gonna adjust this so I can see things a little bit better. In fact, often I hear from my colleagues that they have greater career expectations, like what they can accomplish throughout their career. They feel more committed to their organizations, and organizational commitment even more so than non-mentored staff. So what does mentorship look like? This is the hardest question. You're like, how does this even work? And so fortunately, there is publishing on this as well. And I like this one where it's like a 6-phase process to just try and outline this to say, where do I start? And then what are the expectations on finding a mentor? And also, if you become a mentor, to be able to delineate exactly maybe what your role is and what your role is not. I like to have a phone a friend, but they tend to be different people than your mentors. So it's just a matter of figuring out professionally, where do we sit and where do we align? Where can I help you out? And where maybe do you need to find a different mentor? And so the first thing is choosing a mentor. So depending on where your goal is moving forward, you're going to want to find someone that has a little bit more experience in this area. So key factors I always think about are time and fit. So similar to like finding a hairstylist or noting what your favorite ice cream flavor is, sometimes mentors that seem like a natural fit are not always a natural fit. And so this might take a little bit of time, a little bit of question and answering to ask the person that seems to know a little bit more about this, do you have time? Number one, to mentor me. And number two, do our kind of learning styles and relationship styles gel together? Once you do seem like this is a pretty good fit, we tend to get acquainted. So I usually set up a meeting and say, hey, I want to touch base about working on this type of project. And so I formalize the relationship by really defining what I need that person to do. When you're like just a baby Bambi learning all of these steps, this is harder to delineate. But I think the more experienced people that you get in touch with, they'll be able to say, I think I can help you out with this, maybe refining your question, or I think I can help you out with this, really nailing an ultrasound view, or I think I can help you out with this, like I'm really good at a difficult cervix, right? And I'll help you navigate that. We'll touch base maybe once a week if you've had some hard times or some difficult cervices, or maybe I'm available during this time and this time if you just want to drop in and we can talk about that. Setting goals that are clear and have an objective and measurable outcomes is also on the list, just to make sure that you know that you're progressing forward. So if you do have things like, I am going to write my first abstract this year, or I am going to, goodness, what would be another one? I am going to get out of orientation and start doing my own independent ultrasounds, or I am going to, any of those goals, or I'm going to join ASRM and I'm going to meet someone outside of my individual clinic. Like I just want to meet one more person. Make sure you have measurable goals just to know that you are progressing, and it's kind of like the sunshine folder that you're like, oh my gosh, I am amazing. Even on these hard days, I'm really progressing to things that I found out that were important to me a year ago. Growing the relationship, I do like to outline regular meetings if possible. So sometimes this might be, Shana and I are going to touch base once a month. And sometimes this is going to be, we're going to touch base once a week or once a day when you're earlier in your career, just to touch base on quick questions. Other times this might be quarterly or even just at the annual meeting. So depending on what this is, just have a schedule in your head about what that might look like. Also important that sometimes these mentorship phases are going to end. So sometimes there is a conclusion to this relationship and you're not breaking up with each other. You've just realized that, you know what, this was a really great thing that we created together, and now I'm going to network and branch out in other directions. Finally, I always this is a piece that I'm starting really in my career right now, like all of these years later, to really evaluate the relationship success, really to guide other people to say, you know what, I started here and I think the person that you need to look for is in this area. So finding a mentor, right now, I think the easiest place to start, especially when you're starting out your career, or if you're mid-career, or even if you're late career, are at your current place of work. You'll be able to see and get to know each other, whether this is in the break room, whether this is in everyday clinic experience, or whether this is in out-of-work functions. And that you'll be able to find out as an easy place to start, just someone close to you that can help you get to your goals. Otherwise, you can find a mentor through the APPPG, or maybe AP3G is what we're playing around with because there's so many P's in it.
There's a lot of P's.
So if you're wondering, gosh, how do I meet other APPs? How do I even touch base on a more frequent basis to know what's happening in other clinics if I want to start something or adapt some other practices or get some new ideas? Things that are upcoming just here at the ASRM meeting are the all-in reception or the society social hour. So that's today at 4:45. We're going to have a booth. You can come introduce yourself. We'll get you a LinkedIn. There's the professional group reception. So if you're not an APPPG member, you can sign up today. And we can guide you through that at the Society Social Hour. And at that, we have a professional group reception on Tuesday. And that way, that is going to be a great reception that will all gather together. That is with all the other professional groups as well. And then in this March, we're going to have an ASRM APP specific conference. This is in Nashville. We hope to see all of you that raised your hands, that you are other APPs. This is going to be APP specific content. So we know that in reality, a fraction of APPs commonly are at this major conference just because we are covering for our clinics. And so I feel very fortunate to be here, but it's not reality to a lot of our colleagues who have to stay back and cover clinic schedules. And so this is why we are offering an APP clinic or APP conference that will be specifics to APPs in reproductive medicine. So this will be March 7th through 8th. We will have brochures at the Society Social Hour as well. So if this looks a little bit blurry and you're like, what exact time was that? That is March 7th to 8th. It's in Nashville. And all APP content. This will be APP guided lectures as well as hands-on type activities. Where else to learn more? So whenever I first start working with students, I used to say things like, well, you're just going to read and read and read and read. And these first couple of months, even to the first year, are going to be challenging. And then I realized not everyone learns that way. Not everyone's like a super reader to be able to digest material. And so recognizing we have learners that learn in multiple different ways, there's lots of ways to pick up new skills and to pick up new knowledge. So my favorite things when I was first starting was the ASRM course catalog. So there is the RN certificate course or the nursing certificate course. We are working very hard. So in the question and answer session, I see very key players that will be able to answer additional questions about this. But we're going to hopefully in the next year or two have an APP specific course material that will be able to outline things better. But there is always webinars. So if you're an ASRM member, you get all of those regular advertisements. We'll also talk about our own APP professional group has monthly webinars. So if you're an APP PG member, we have monthly webinars and these topics range every single month. And so I think we've done close to 6 so far with topics that have ranged from male factor infertility to understanding IVF to pelvic pain, to professional development. We're going to be reviewing all of our abstracts that were presented here in November, and then we're going to talk about ideal intrauterine imaging in December. So that's just the rest of the year that are all free for our APPPG members. So if you know people or are not members yet, there's great learning to be had once a month, just learning from other APPs. At that same time, if you are into your career and you're like, you know what, I've got things to say, I've got things to teach, please reach out to me. I'm happy to get you set up to host one of our webinars because we know that there is a lot of value and knowledge within our group that I would love to hear from you to be able to host a webinar for 2025 that we're building our calendar. I love podcasts, and so I have learned that I have usually like 10 to 15 minutes one direction on my way to work, and that's how I digest micro-learning. And so I love the ASRM talks that are all out there when it comes to podcasts. I love shorter learning, which is like similar to the ASRM Med Talks instead of those longer lectures. Engaged MD Fertility Skills just have a clinical fertility clinic or like short little videos that are nice. You do have to register for that. They're out in the expo if you want to learn on more information. I have nothing to financially disclose with them, but I have found them learner if you want little micro 3-minute videos to gather little concepts on. Very good. Fertility and sterility, some love to read a traditional journal, which I think is amazing, and like, show me your ways. But I know there is plenty of ways to digest fertility and sterility. And we're going to comment on that on the next one. When it comes to books, Early Pregnancy, I know, is one of Shana's favorite books. Do you want to comment on that?
Yeah, so this book actually is really, really good for, I think when you're talking about like all the nuances of pregnancy and kind of the differing things and what's normal, abnormal, they have great images in this book specifically. So I usually have most the new providers get this book. It's been really, really helpful.
And then do you want to comment on the 3D ultrasound YouTube video? You found this little gem.
Yeah, so this little gem is from radiology at Harvard. So this YouTube link goes into 3D imaging. It's really good for showing you when you're like, is that pregnancy too high up in the corner? Trying to figure out and differentiate ectopics when you're looking at like, on face or to the side. So they just have a lot of really great images and examples from the radiology clinic there, and they walked it through very, very nicely. So I believe that YouTube video is about 30 to 45 minutes. So easily digestible, but very good information.
Okay, podcasts. I commented on this briefly, that this is my favorite thing to engage in on my commute to work, where I seem to be like tuning in to and ready to get my brain on for the day, essentially. So my favorite ones are Fertility and Sterility on Air. These are all about 1 hour long. So sometimes that might be a grocery trip, right, on top of your commute, or depending on where your commute is. ASRM Today always talks about timely hot topics within ASRM. These are shorter skits, but you can kind of subscribe to both of those podcasts. And then I see a host of the whole pineapple in our room. So Ann Judge was one of the hosts on the whole pineapple, which talked about fertility content and just hot topics. Really helpful when I was first starting out to just start to digest some of these topics and get different perspectives on how different clinics manage this and just actual personal perspectives. Up to date, if your facility subscribes to this program, always gives very timely synopsis. So instead of doing a full lit review, you can get a quick summary of the data in a fast way. I use this so much for topics where this is not my everyday language. Like someone comes in with primary amenorrhea, and I'm like, oh no, please no. What happens now? And so if you need a quick refresher on how we work up these various things, or really even latest and greatest treatment, or if there was a new study that came out, all of these are refreshed very frequently, that you'll be able to see when the latest authorship was. And then social media. I love to digest fertility and sterility through social media. I feel like they do an excellent job on their Instagram account of bringing up hot papers and doing a quick slides over the highlights, essentially just reviewing the quick abstract above it. And so if you are on social media like Instagram, fertility and sterility is very helpful for just staying abreast of the literature and getting an idea of whether or not this is a paper you want to fully read, or if this seems to be something that doesn't require a full investment. ASRM, of course, does their own social media. We're just in the expo hall, and so look for us, okay? That we just joined in. I think they always have interesting content, and so if you subscribe to ASRM, they're always advertising a lot of these events that we're talking about on this PowerPoint today.
Has anyone, or how many of you are routinely listening to FNS on Air? Not too many. So FNS on air is really, really good. So they go through each monthly FNS journal, and it's a conversation piece. So someone brings up the topic of the article, and then there's usually 2 or 3 other people on the panel that they're chatting about the article. And it's a great deep dive in multiple direction discussion about the article. And sometimes it's enough that you're like, oh, okay, I understand what they're talking about. I'm good. Or sometimes you're like, oh no, I really want to read this article. So it's a great conversation piece to hear people just chatting about the that month's subscription. I think it's very, very good.
Definitely on the top list to start subscribing to.
Yeah, they're great.
And I appreciate the background that they often give to these, because sometimes you just see the title on the FNS Instagram and you're like, okay, I don't know all the background behind this. And there's always a wealth of different perspectives. So very nice. And then some specific practices will have their own social media. So if you are working for a specific practice, you can subscribe to their page. And sometimes it's just timely patient information, amongst other things that would be helpful tricks and tips. Okay, conferences. So Shana had commented about how do we start figuring out if my organization includes continuing education, medical education funding. And if they do, this of course is not a comprehensive conference list. We know that you all made it to ASRM today, so that's great. And if you're in a situation next year when you're not able to attend because you need to be covering your clinic, here are a list of common conferences that also are great for APPs. And so, of course, there's the annual ASRM Scientific Congress in October that rotates locations each year. We talked about the ASRM APP conference, so for real, if you're thinking about it, just go ahead and sign. Well, registration does not open. It opens November 1st, but we do have a website. So if you just type in APP ASRM conference, it will come up for Nashville in March. The Pacific Coast Reproductive Society, that one is usually in March in Indian Wells, California. The Egg Donor Meeting is usually in April in South Carolina. And the Midwest Reproductive Symposium is usually in June in Chicago. And then the StartArt Congress, this is a great low-cost congress, especially for our nursing colleagues and new-to-practice APPs. I loved attending this congress when I was early in practice because it's very low cost, and usually the hotel is lower cost, and their lectures are excellent to build your knowledge base regarding REI. Okay, where else to get involved? So once you're starting to really nail your REI practice and want to get into advocacy, there are several ways to get involved. Resolve is the National Infertility Association, so mainly the patient side of advocacy, and they always have lots of events in terms of advocacy that you can become representatives, either on your own or as part of your clinic. And then also the CADE Foundation. And finally, we'll talk about learning from other APPs. And so I mentioned this before, that we have our own professional group that we host monthly webinars. If you're interested in hosting a webinar, or if you're like, I just didn't even know they're out there, they're on our APP professional group page. If you just click on the events, it's going to bring up all of our webinars that are already there. And so they're free. They're generally Tuesdays, so it's the second Tuesday of the month. The time varies, but if you've got feedback on what time might work great, I'm open to hear that feedback. It's just we're all across time zones, and so whoever is talking gets to choose the time right now. That might not always be the case, but that seems to be a good rule. Second Tuesday, the time changes. There is the APP discussion board. This is one of our best ways to get answers to questions, right? Like, what are other practices doing? Or give me your opinion about this. And so that is also available on our APP professional group page. There is no there are no topics that are strictly off limits, but there are rules. So just know if it's really an appropriate discussion, it's going to be published and you'll get feedback from your colleagues. And then finally get involved with the APPPG. And so as Shana is the current chair and she'll be transitioning off, I will be the chair come, I don't know, next
Tomorrow. Tomorrow.
But we are very approachable. And so I don't want you to feel intimidated. Please introduce yourself, because I would like to get to know more people throughout the country. There's a lot of power in networking amongst ourselves and really getting to know what different practices are doing and how we can support each other. So we are full uplifting non-compete APP group. Okay, so future endeavors. I hope we can have a little bit of discussion about this, but this is kind of what's in the know and what's coming down the pike. Is we have an APP educational task force that was formed, and we're really looking at forming competencies for APPs. So many of our physician colleagues talk about, I'm not sure what you can do, how do I know if you're competent, how do I know if you're ready? And so this task force is taking on this huge, huge thing. So thank you. If you're on the task force, if you can raise your hand.
Thank you.
We hope to chat more about this, but if your physician asks, gosh, how do we even know, what is this going to look like? This is one of our future endeavors to try and outline this, to know when an APP is competent in a lot of these REI skills. We're looking at REI-specific ultrasound training, right? We do not need like third trimester scans, and we don't need full comprehensive ultrasound skills, but we need a more narrow focused ultrasound training. So we're looking at options there, as well as the APP certificate course. This is hopeful down the line, just like they have an RN certificate course that will have something more geared towards APPs that you can go through for didactics. Coming soon, you might have heard from Robin Scott or heard through if you're on the NPG boards or the APP-PG boards, is that we are renewing the NCC certification exam. And so this will be for the, does anyone know, it's Women's and Reproductive Health? There's a name for it. Reproductive health and infertility exam. So if you're looking for an actual certification exam, more kind of credentials to put behind your name of a national certification that you've completed, that will be upcoming. We're hoping that will become available in Q1. So stay tuned for that. I, for one, am going to be getting a study guide. No, I'm joking. It's going to be fine. But this will be upcoming. There is a lecture on this as well. So I believe that is Tuesday. Is it Tuesday morning? I'm going to look at it and I'll update you on the Q&A. But there is more information on this certification exam. I believe it is Tuesday or Wednesday morning that's upcoming. And research and quality improvement. So this was like a good big goal of mine over the last 5 years, and it was very, very, very intimidating to start. Meaning I think our physician colleagues are groomed from the time they're medical students to start thinking about research and quality improvement, and that this is not something that is always comes natural to our APP programs. And so I think the first thing is to start refining your idea, chatting about this with a mentor. If you have something that you have a question or you have just a problem that kind of needs fixing. This is starting with a mentor who has done more quality improvement or has done more research to start saying, how do I start approaching a project about this? And they're going to help you, number one, to refine your idea that it's going to start here and then you're going to like go to here, right? So you're going to make this as small and tiny to begin with as possible. And then the second thing that is often nice is if you can join a team, if there are research activities that are happening in your clinic, this is a great thing to say, you know what, I'm going to start doing data collection or data entering, or let me start reviewing some articles to add to this review list. And so I think that's an easy place to start and start dipping your toes in the water. There is mentorship, so if you're like, I'm ready, help me out. We do have an APP-PG research committee. So if you are struggling to either refine your question or just get your study off the ground or even just dive into a little bit more quality improvement, know that we do have a research committee and we have a PhD that chairs that committee that can help refine this process for you. And then finally, there are funding opportunities for APPs that you might not even be aware that they're out there. And so the ASRM Research Institute has the ASRM Nursing and Physician Research Professionals Research Award. So there is money to be had if you're looking for funding. And this historically has always had very few applications. So if you do have an idea and just need a little bit of help, this, again, we have our research committee, and then we can really encourage you to start applying for funding opportunities within ASRM. Goal setting. So the final thing that we'll talk about is I never want to give APPs like one more thing of things to do, right? When you're new, you're like, I'm overwhelmed. I don't exactly know what to do. It's just starting to reflect and work out what do I really want to accomplish in 1 year? And it might not be much more than just learning the practice and becoming an APP-PG member. And that is all A-OK. If you have special interests, you could join a special interest group and really just start expanding your network. That might be at only your own place of work, and then within APPPG, start learning other people just at either our member meetings, at a conference, or even at our webinars, starting to know different names that we introduce to each other. At 5 years, you can think about mentoring someone else or becoming or looking for more mentorship opportunities for yourself. Think about speaking opportunities. We have speaking opportunities that you could ask us about. So if you're interested in speaking, either amongst colleagues, right, at your webinars, or if you're looking at more national events, please come talk to us about it. If you want to get into reviewing abstracts, we can help you get started at that to know, how do I even review an abstract? How do I figure out whether this would be a good abstract or a not so great abstract? We're hoping to host one of our webinars about reviewing abstracts, and then in February, Chevis is going to give our webinar on actually writing an abstract. So if you've never written one before and you're like, I need the 101, please, that is happening in February. That will start guiding you through that practice. And then partner on a professional project. So if maybe research or quality improvement are not your jam, we can think about other professional projects like joining task force within our APPPG and other activities. Okay. At 10 years, we talk about developing a passion project. So all of us start to develop these little niches of what we really enjoy. And then you can really start developing your passion project from there and thinking out leadership roles, particularly if they haven't happened in the 1 or 5 year mark. Think about, gosh, you have a lot of knowledge in there. I want you to start thinking about how I disperse it to others. Here are our references, and thank you for your time and attention. Now we're looking forward to hearing from you. We can just do a panel discussion. Shana and I are going to sit together over here.
Does anyone have any questions, things they want to chat about as far as, yes, go for it.
So we have an APRN for the first time, and so we're trying to figure out how to optimally utilize her in our practice. So can you talk a little bit about what you do? When I was at the Mayo Clinic, we didn't have any APPs in our practice. What are you doing on a day-to-day basis? That's what I want to know about. How can you best use your expert services?
I can start. So just within my practice, so Shady Grove has probably 50 plus APPs, and we probably have 50 plus different things about, how our days are all different. So the main goal is to figure out where your needs are in your office. So if that is that APP running monitoring, so then a physician is opened up to see new patients or follow-up visits, and that's where the need is, versus there's a real need for someone to do, procedures and do saline sonograms and in vitro biopsies and OB ultrasounds. So all those things I listed, I personally do. I am very procedure-based at my practice, so I do monitoring, and so I do the ultrasound and then also am counseling at the same time about what I think is next, what they're looking at, what we're looking for, kind of walking patients through that part of their cycle. I'm doing saline sonograms, IUIs, doing biopsies, OB ultrasounds. People also who call in and that have a question, having any pelvic pain. I also see bleeding OBs. A lot of our APPs actually do a lot of HSGs. I personally don't have that capability at the office I work at. So that's kind of, ours are the bucket of what you can pick from.
I agree with Shana that this differs from practice to practice, and this is what we're learning about our professional group, is that we want to keep APPs marketable, right, to do all the REI things that a practice would be open to, and at the same time, they may be, your individual practice may be specific to where they need you at. And so I think the first thing that we want to do is to develop kind of guidelines for competency, so you have an idea of what your APP is all capable of. And then from there, your individual practice may change. So I work in a very high surgical practice, and so I am seeing more postoperative visits and removing more catheters and doing more office-based procedures on top of seeing patients. I don't have to do ultrasound scans because we have sonographers that do all of our scans. And so it will change from practice to practice, but I think the most important thing is to say our goal is that your APP is going to be very competent and you'll have a full menu of what your APP can do. And then based on your individual practice, how they're utilized may change. Go ahead, Tamara.
I was just going to comment on that. As far as the competencies we're looking at,
Yeah, do you want a microphone? Yeah, I think this is important.
but thank you guys, because that's exactly what we're looking at, because it's going to vary on the different offices, but these competencies that we're trying to develop through ASRM, it says for APPs working in REI, these are all the different procedures that we think they're very capable of doing, and we're going to give you the resources to learn. So it's procedures, so maybe heavy procedure base, and then also consults. And these are the patient types that they might be seeing in your practice. And so perhaps it's age less than 38, maybe it's your basic infertility workup, it's your PCOS patients, your egg freeze patients, and maybe donor sperm. And so like these are some of the consults, and what I'm seeing when I've talked to different APPs in different parts of the country is that where you get the most satisfaction is when you get a little bit of everything. Mm-hmm. And so when their day is mixed, like my day is completely mixed, where you're doing ultrasounds, you're doing procedures, and then maybe the APPs, when I have my survey that we're going to talk about tomorrow, but on average, APPs are seeing about 3 to 6 new patients per week. So just a little bit, but enough to give them that autonomy. They're doing their follow-ups, but they're also helping the office with the procedures and what's needed.
Highlight some of the resources that are available for APPs or practices that are looking to utilize APPs. So Tamara and Nicole just published a paper in FNS, what was it, 2 weeks ago? Yeah. That really highlights what the APPs can do. We have a forthcoming white paper, Janine and Natalie who just popped out, are spearheading that. And then the educational platforms that Nicole and Shana mentioned are going to hopefully provide resources to get APPs practicing at that level of the scope, or the full extent of their scope if they want to.
I misspoke when it came to the REI nursing competencies, the national and international perspectives for the NCC certification. It's Wednesday at 10:45, not Tuesday. So you can add that to your clinical sessions if interested.
Yes.
I'm a physician in a 10-physician group, and we struggle a little bit with should we try to assign an APP to only work with 1 or 2 physicians, or if they have a skill set that would benefit all 10 physicians, should we organize it that way? We haven't figured out a solution.
There is no solution. You can do both. So it just really matters how your physicians want their help. So I personally, for the past 11 plus years, was the office PA. So I was on everyone's team. So I was the point person for everyone's team. And that's how I was very procedure-based. Within the past 6 months, though, I still have that procedures for every team, but I'm assigned to a specific physician now. So I am that point person for a specific physician that needs a lot more help with their caseload, because that physician has a lot more duties outside of just their caseload of patients. So that was a very strategic move where we decided that this physician needs a specific APP, and then I'm that point person for her nurses. If patients want to touch base before that physician has a follow-up visit available, I can call them. So that's a very long answer to, I think both ways work, but it really specifically matters how your physicians want their help.
But as an APP, which I think we want to make sure we're not asking something of the APPs that's not going to be successful?
So I think being a part of the whole team is actually really beneficial. So I like being on everyone's team because I learn how everyone does things a little bit different. But when I see a patient that's this physician's, I know that they're going to want to do it like this. But if it's this physician, I know that they're going to follow up with this. So I learn how they all practice, and I just help funnel their patients in faster into treatment. And I'm there to help with productivity and patient satisfaction.
We have separated our practice a little bit differently, that we have 5 physicians that I work with, and 3 operate regularly and 2 don't. And so I shouldn't say don't, but pretty rarely. And so I work with one other APP, and she has a higher interest in third-party reproduction. And so the surgeons that don't operate have kind of taken over the third-party reproduction piece, and she coordinates when it comes to FDA screening that I know nothing about, manages all of that, and I'm with the 3 surgeons. So fielding the intraoperative questions and the postoperative questions and those things that come up. So we've narrowed that way. We, of course, are kind of still do broad counseling, but we do have specialized that based on kind of what our practice needed, as well as individual preference. Yeah, go ahead, Tamara.
I love this. So when talking about mentorship, and so in our practice, we have 13 doctors now, and we have 11 APPs. We're spread out in all different practices. So I really think how you utilize your APP is going to be individualized, but what we found in our practice is we're all spread out. We're at different satellites. I at least have one APP at every satellite, but we hold monthly drop-in sessions with one of the docs, and we started this last year, and it's been fabulous. It's on their schedule. It's one doctor. They rotate every week who the doctor is. All the APPs get on the call. It's a 30-minute Teams call, so we do it through Teams, and we get on, and then we present cases. So it might be like, oh, Dr. So-and-so, I just did this OH. I don't even know how to describe it. Can you help me? And we review it together, and then they give us advice. Or this was my HSG I did this morning. What do you think? And so it's interactive, and it's live, and then the next meeting, we have a different doctor on. So we're really engaging and learning from all the different doctors, and then it's really a great way for the APPs to see each other every week too in the different practices. So that's what we do. It's been working great.
Yeah, we have something very similar, Tamara, that we meet every day from 1 to 1:30, and we have a group practice in terms of talking about people going through their IVF treatment, but also the 5-minute forum, right? That you're like, oh gosh, I'm really struggling with interpreting that. And I think it's really important as APPs that you have that. Yes, that you just have that catch to say, I'm not certain, can you help me? And it's such a beautiful learning opportunity.
I think whatever you choose, though, the important part is to make sure, when you're talking about that satisfaction of your APP, to make sure that it's a conversation piece that can be finessed a little bit, like this is working, this is not working, and make sure that appreciation, that when you do hire a APP, that person is considered another provider in your practice and not just someone that is just helping out just to help out. So just making sure they're part of the group in the conversations about the practice, how they're doing, what we want to change, things like that. I think you'll get satisfaction from that person no matter which way you go if you do that.
We hear the opposite feedback, which is all 10 of you do it differently, and I'm confused because if I'm doing it for your patient, so I like that you're all saying, that's interesting, but that's not the feedback we necessarily are getting.
Oh, that's so interesting. We can chat later too. Yes, go ahead.
Hi, my name is Disha. I wanted to just comment on the last slide that you presented about this group of providers who's helping APPs put their name out there and teach and explain. So Tamara and Shana both helped me to present for this Wednesday at 10:45. Actually, conflict of interest is what you're So the talk I'm going to be giving is about APPs who can start their own practices. What I will say is when Tamara presented this to me, it was like, there's no way I can present ASRM as well. But they did all the legwork. They presented, the title, the paperwork. God knows what you guys had to do to make that happen. I can't emphasize enough how great of an opportunity it is to be part of this group. So do it and hopefully it becomes a problem.
Do you want to give your title?
Yeah, it's called Where Needs Exist, We Can Do Better. I'm presenting with a midwife from Seattle. So two different models. One is a, low tech, no medications, no ultrasound, none of that, but just therapeutic donor examinations. And then my model is a little bit more of what you guys are doing in practice right now, prescribing COVID, letrozole, trigger, using ultrasound guidance. So we're just kind of talking about maybe individual practice settings that you can have. But certainly, join whichever lecture applies most to you.
Thank you for your contribution too. Thank you. Was there anybody else's hand that was up?
Anne.
Go ahead, Ann.
So as Trevor mentioned, we have high low APs, but they're all spreading to different offices. What do you all think is a good way of helping people still feel connected as part of the group? You mentioned in-person activities, and that's really hard if you're all.
So we do try, and we have regionalized groups. So we have a listserv for our APPs that are kind of across the country, and then we have a listserv that we have. The majority of ours are in the DC, Maryland, Virginia area. So we do try and do. We do have a journal club that's every quarterly, and then we'll try and do that group meets in person. For sure, it is difficult to get everyone's schedule. But if you just have them on the books, kind of, you can get some sort of rotation in there where the people who are in that area can get together in person. I just think there's so much lost on a video screen. It's so giving to see somebody in person. You just get a different type of connection.
I agree. We have Thursday fellowship didactics. So I work with 3 REI fellows. And so everyone's invited regionally through all these, but it's video. It's not face-to-face. And so there is that connection if you keep your video on, but very rarely does everyone keep their video on. So it's a challenge. Do you?
For our drop-in sessions, I'm like, turn it on.
Yeah, your video's on.
Someone else had a question over here. Yes, go ahead.
I have a question about HSGs and how APPs can perform them, because in certain states, APPs cannot interpret them. The physician has to interpret them. So what has been the model that most people are using to where the APPs perform the HSGs, and then how do they get a physician to review them? Is there a better way to do it instead of just finding one that's in the hallway and saying, hey, can you interpret this?
So we have a couple. So what we would do is, our one HSG, our fluoroscopy is in the same building as our ASC. So what happens is the physician that is on doing procedures, they're doing retrievals, that person is in charge of going through and reviewing the HSGs that were done for the day. Or some regions, what they'll do is that person, the PA or NP does the HSGs for the day, and then it goes to whatever the physician of record is for that patient, and then that physician has to review it for the day. If that person's out, so obviously there's a covering person that's in charge for their results anyways. But so then there's always an agree and then name at the end, or add a comment.
Yeah. I work in an academic center, so we have radiology residents that nod their head and sign their name.
Agree.
And come to the talk tomorrow, and I'll talk about it a little more.
Yeah.
A little more at HSG.
Good plug, Anne. Good plug.
Yes, go
Anne,
ahead.
do you want to say your name of your lecture too tomorrow?
Yeah, Tamara and I do. It's Perfecting an APP's craft. So we're going to talk about OHs, SISs, and HSGs, and kind of the tips and tricks, the things that, we wish we learned early on.
Yeah. Go ahead.
I was just going to say that our clinic has implemented HIFOC instead of HSG, which has to use multisonography instead of needle and not just and we've been really satisfied with it. So we just exactly what we push it, go check it out. And our patients have been really happy because it's really less intense than HSG as well.
I think that's a great tool specifically also for when you have practices that are very remote, when you need a way to do tubal patency. So at the APP conference, we're actually going to have a demo for XM foam, and I think it will be wonderfully beneficial for practices that utilize it.
So if you're curious, it'll be there.
Yes.
What is the cost difference though when you're doing the HSG versus the HIFOC? Because that is something we talked about, and they said that it was very expensive to do the HIFOC, and that's why we kind of still are doing HSG.
You have hand raising over here.
Yeah.
Because again, this is, when you do an independent practice, you have to kind of know what everything costs, right, when you're buying it. So you can, each device costs around $200 for you to purchase. And then you can charge a clinic fee for what you're going to charge for the actual procedure. So they're working on getting that device to be covered through insurance, but it hasn't rolled out yet. You can talk to the team specifically about it. But yeah, cost benefit, instead of getting all of that equipment you need for a traditional HSG, ASRM has definitely changed my practice.
And also, this is my soapbox, I think some of this is do a better HSG, because I feel like, it gets a bad rap sometimes, and if you can be doing your HSGs in like 10 seconds without, I feel like there's a range, especially when I have patients that have had one at like an outside radiology center with this hellish experience, and they are like amazed how good and fast our HSGs are. So, come tomorrow.
Ashley?
I was just gonna, not a question, but comment to the care team model. So in my previous role, it was more of a care team where you basically had one physician partnered with a nurse practitioner. So a little bit different, but my role there, I started as a brand new nurse practitioner. And so starting as a brand new nurse practitioner, being paired with a physician and learning from them, we were very consult heavy. So the way that I started was the physician would see the patient for the new patient visit. They would come up with what they thought was happening. If this patient has PCOS, if the diagnostic testing confirms, start her on letrozole 2.5 and timed intercourse for 3 cycles. So then I would see her for the follow-up, review all the testing, say whether or not it was normal, and then initiate the plan. If it did not confirm, obviously we deviate from there. I could always have a side conversation with the physician. But starting that way with these shared care visits where they would see the attending, then they would see me, then they would see the attending, then they would see me. It was not only learning for me, but very good continuity of care for patients. And then it got to the point where I've been doing it for so long, I could do it with my eyes closed. So I started seeing all of these new patients. And if they were something very complicated, like we're diagnosing POI, I would do the workup that I knew was necessary, but then refer to the REI, to initiate that plan. Where if it was somebody that I saw that was new and unexplained, I would just keep them. And then now I had my own patient load. So that's what you could kind of from start to finish work towards if you wanted to do more of a shared care model, where really initiates kind of that care team where you have that partnership between the attending and the nurse practitioner. So again, there's no model that's wrong. I've seen and done a lot of these different models. I think the biggest thing is the partnership, the support, and defining what your plan needs. But there are lots of different ways that are very successful to do this partnership.
And it's not set in stone.
Yeah.
We change it, yeah. I just changed mine after 11 years. So, yeah.
Okay, I think we'll wrap up, but before everyone leaves, can we do a quick video? You want to give us like a high five or a wave? This will go on your LinkedIn, so just dunk under your desk if you don't want to be part of it, right? Or just put up your hand without your face. Okay, hold on, we're gonna be like, ooh. Come, let's go down here, Shana, and then we can go all together. Okay. Everybody ready?
Okay, thanks everyone.
Thank you.